Welcome to the Pockets of Knowledge podcast. I'm your host, Desiree Stanley, and with me today is my special guest, Dr. Reena Patel. Welcome, Reena. Thank you for coming on the show.
Thanks, Desiree. I'm so happy to be on your program today.
I'm honored to have you on the show to share with us some very important information about heart health and more specifically women's heart health. I've got some great questions. We had a couple of minutes to talk before the show began, and so I want to share some of those things with the listeners as we get going. But to begin with, would you share with us a little bit about your journey to get into medicine? Was it always something that you wanted to do? Did you know right away growing up, I want to be a doctor?
Well, I come from a long line of physicians. So, the example was certainly set out for me from a very early age. My dad's a physician. A lot of my uncles and aunts are physicians. It's sort of part of our social and cultural history. So I did have an inkling that I might be a doctor. In all actuality, I actually tried to pursue many different things before I actually went to med school. I graduated and then worked for a couple of years and then realized that it was my true calling. So once I entered medical school, like many people, it's like a train that's, going one way, and it's going fast. It's hard to get off. So my path, once I entered med school was pretty straightforward, but there was a lot of bumps along the road. I mean, there was so many challenges, not just with the educational portion of it, but also with having to move around the country, entering different training programs, and then also trying to balance my personal life as a woman. I always knew I wanted to have a family. When you're in medicine, the duration of education and then post-education training, residency, fellowships can really take its toll. To balance that was probably one of the hardest things that I had to do as a female physician.
Yeah, I imagine that would be very challenging. There are so many years that you are going to school and then building your residency and all of that. I imagine that balance is can be very difficult.
It can be, especially when you're trying to pursue a specialty. Cardiologist, you have to do your general internal medicine training, and then after that can do 3, 4, 5 years more of training, depending on what you want to do in cardiology. I think by the time I entered my fellowship, I was ready to start a family. I was already married. And I remember a couple colleagues, older colleagues of mine saying, oh, we didn't know you wanted to have kids. Kind of like, oh, we just assumed you went into cardiology because this was going to be your baby. It's sort of that mentality. I think things are changing. Also, I would say that, historically, cardiology has been a male-driven field. Still, females are underrepresented in our specialty. It's evolving slowly, but, that mentality is still there that, you have to choose one or the other. If you choose both, then the struggle is real. I can tell you that.
Yeah, I imagine that would be the case. And so has that posed some setbacks for you in this journey?
Certainly has. The hours can be grueling, even in training and then even in practice. The workload is heavy and can be very stressful when you're dealing with people's emotions, people's health, people's, lives are at risk. There's a lot of stress that comes with that. And so it can be taxing, but at the same time, I think, with time and with patience, really with a lot of self-compassion, understanding that in order to help someone, you don't have to be perfect, that you could be struggling and still have the capacity to help other people, and that a majority of people appreciate that effort that you put in. It goes a long way. Showing gratitude. When people show gratitude to me, it's easier for me to be grateful for this amazing opportunity I have to, really touch people's lives in a very, very dramatic and significant way. And I think that that's actually what keeps me going most days.
Well, that's excellent. Thank you for sharing that. With your children, have they been understanding in what you're doing? And have you, talked with them about the importance of what you're doing? And I'm sure setting a great example for them.
I think so. I mean, I have a daughter who's 11, my son's 8. When they were younger, it was easier, because they could be, at preschool or with a nanny and, oh, mommy's coming home late. But as they've gotten older, that's not as acceptable. And I do have a domestic side to me. I like to be at home with them. I like to volunteer at their school, be home for dinner, make dinner. I mean, these are aspects of my personality and aspects of my life I didn't intend to give up when I went into this field. They are very acknowledging that mommy has a busy job, that I have an important job, and that at sometimes I have to prioritize my job even over things that they might think is important. But I think they've been raised, in a culture where they see a lot of their older figures working, or, my husband works, their aunts and uncles work, and everyone really sort of has their place in society where they're functioning outside of the home. And I think they appreciate that. I know my daughter is extremely proud of me anytime there's an opportunity to tell somebody that her mom's a cardiologist or her mom saves people's lives, as she likes to say. She takes those opportunities. Certainly there's moments, I'm sure, where I'm not around, that maybe other moms are there that she wishes I was there. But I think that there's a maturity that comes from that, and also a lesson too, that just because I'm not present sometimes doesn't mean that I don't care or that I'm not a good mom. They know I care and I make every effort to be there for them. And as long as they acknowledge that, and I feel good about what I'm doing, I think that it's a good situation.
Yeah, for sure. And you're also teaching life is a balance, right? I'm here for some of your events or some of the things that you're doing, but some of the time I have to go and do my job, which is adorable that she says saving people's lives, because you do. And I love that. And so let's transition into that conversation.
Sure.
Let's talk about kind of heart health and just the topic in general. Like, where are we at with heart health in terms of where do we stand?
Sure. So we know that heart disease is an epidemic that's, been growing. Up until 2015, the incidence of atherosclerotic cardiovascular disease, that means plaque buildup in your heart, what causes a heart attack. And that's specifically what we're going to be focusing on today, and lifestyle changes that individuals can make to avoid the development of that type of heart disease. We knew that there was a steady decline in heart disease up until 2015. And after that, we saw a slight bump in the incidence of heart disease. And it was really correlated to obesity. And we know that obesity and patterns that lead to obesity start really early in adolescence. So the pattern of eating, the risk factors associated with diabetes being one of the most prevalent risk factors for developing heart disease, really can start at a very young age. And there started to be a lot of emphasis and focus on what we could do for primary prevention. And what primary prevention basically means is we don't want to start intervening in patients' lives after they've had a heart attack. We don't want to say, okay, now you've had a heart attack, why don't you start exercising and follow this diet pattern so that you don't have another heart attack. The idea is that if we can prevent the initial event with a healthy lifestyle that we'll talk about a little bit more today, with diet, exercise, and other patterns that can have a significant positive impact on decreasing the risk of heart disease, we should really start to implement those early on. We know that the burden of heart disease in our country is tremendous, not just financial, but days off, time off work. The emotional burden is also heavy for families. And so there is a huge investment that the American Heart Association and physicians have put into helping patients understand what type of lifestyle changes can positively impact them so they don't develop heart disease.
And makes so much sense, right? It's like, why would you try to treat it after the fact? Although that happens and you have to do that, but it's really way better to start from the beginning and set these great practices in place from the start. Hopefully avoid the issue in the first place, right?
Definitely.
So what are the most important ways? You did mention like the diet and exercise and that sort of thing, but what are the most important ways that we can avoid running into unhealthy heart?
Sure. So, what you really want to do is avoid the risk factors. We know certain risk factors. I already mentioned obesity, diabetes, high blood pressure, high cholesterol. These are the PATs. These are the risk factors that lead to heart disease. And we know that most people who have a heart attack have at least one of these risk factors. Smoking is another one. And so what we really want to do is reduce these risk factors in individual patients. And the best data that we have to do this is with a healthy lifestyle. This includes a diet that's low in saturated fats, high in vegetables, fruits, healthy proteins, is full with exercise, sleep, low alcohol intake. And, there's a lot in the media about different diets, and I'm happy to go into it in a little bit more detail with you. But the question really is, which diet works? And I always tell my patients, there's not a single diet that is going to work for everyone. There's social and cultural influences that impact patients' diets. There's financial burdens that impact patients' diets. And so what I try to tell them is start by trying to make subtle changes, because those subtle changes over time can develop into patterns that can have a positive impact. From a diet perspective, probably the most studied diet and the one that's correlated with the lowest risk of heart disease is the Mediterranean diet. That diet is really high in vegetables and fruits, legumes. It has, a lot of emphasis on protein from fish, low in poultry, very, very low in red meat, a lot of things like olive oil, things that people in the Mediterranean eat. But they also have a lifestyle, and that includes activity. So that diet balanced with, activity and daily exercise is really what has been shown in most studies to improve the risk of developing heart disease.
And you brought up a good point earlier, mentioning the fats. And we hear a lot about good fats, bad fats. What is the deal with fats, and what are the fats that we should be eating?
Sure. So, really want to avoid saturated fats. Saturated fats are the fats that come from dairy, meat. They're sort of the fats that you think of would be hard at room temperature. Tropical oils fall into that category as well. The unsaturated fats, which are the mono and polyunsaturated fats, are things like olive oil, canola oil, omegas that we get from fish and nuts and seeds. Those are the fats that are good for us. Those fats actually, help with cell membranes, makes tissues elastic. They're important in hormone synthesis. They actually lower cholesterol and can protect the heart. So these are the types of fats you want to look for when you're, in the grocery store, you're buying foods. These are the things you want to look for in the label. What type of fat is in this? Because the saturated fats is really what you want to avoid.
Got it. And so you were talking about diets. I know that there's a lot of talk about intermittent fasting. I'm so curious what your thoughts are on that. Does it work? And does it matter at what point of the day that you're eating when you do eat that meal?
So, Desiree, the interesting thing about nutrition is that because there are so many diets that come and go, and because there is a little bit of fluctuation in what patients report versus what they actually do, randomized control studies, so very controlled studies with hard endpoints like, do people who intermittent fast have less heart attacks? Those things are very, very difficult to study. And we don't have clear data on intermittent fasting. We do know that specific patients have had a lot of success in weight loss with intermittent fasting, but that's usually in conjunction with a healthy diet when they do eat. But we don't have clear data to say that it reduces the risk of heart disease. However, for my patients who are achieving their goals with weight loss, we do know that lower weight can help reduce the risk of diabetes, high cholesterol, high blood pressure. And so from that standpoint, if someone's doing restricted time eating, it's not something that I discourage at this point. We just don't have enough data to say that we need to encourage it. If it's working for someone and they're seeing the result, I just say go for it. I don't think we have any evidence to suggest certain times of day are better than others. I think the traditional theory of eat earlier in the day, don't eat too many carbs at night because that makes you gain weight and slows down your metabolism, those still probably hold true. And most of the intermittent fasting, models that I have seen usually recommend eating during the daytime hours and restricting later in the evening.
Right. And so how does that, or does it have any impact on heart health in terms of that restrictive eating? Does it make a difference, or is it really more about what you're eating?
I think, that's a good point. And I think that's also relevant when we talk about the keto diet, right? Because we talk about the keto diet, people are eating a lot of fats and they say, well, I'm achieving a lot of weight loss, so that must be good for me. I think the idea is whatever pattern that you're eating, whether it's intermittent fasting, whether it's ketogenic diet, whether it's plant-based, whether it's vegan, the idea is to eat whole foods, right? Foods that are naturally
Right.
and minimally processed, smartly processed. Because you can look at someone who's eating a plant-based diet. That a plant-based diet traditionally is a very whole diet. It's full of vegetables, nuts, seeds. For protein, they do a lot of tofu, tempeh. But if you look at a vegan diet, that's different. That can include things like Oreos and snacks, that aren't necessarily healthy. So I think the bottom line is no matter what type of diet you're trying, whether it's keto, intermittent fasting, plant-based, Mediterranean, is to focus on whole foods that are nutritious, a very healthful diet where the foods are minimally processed.
Yeah. Okay. That makes total sense. And I had a friend of mine who is a nutrition coach on the podcast, and she was talking about when she was trying to be vegan, eating Oreos and eating junk. And it's like, just because it's vegan doesn't mean you should be eating it. So I'm glad that you kind of reiterated that point. But let's talk a little bit about exercise. What kind of exercises are good? And is there like a limit to how much exercise is good? Can we go too far?
Well, I think there's certainly, exercise that can go too far. But in general, we want to recommend our patients to be active. Exercise is probably, I would say, as a cardiologist, a little bit harder to even, move the needle with patients on than diet. Sometimes that's a little surprising. I guess I'm a foodie, so I go food over exercise. Really hard to get people to move on a consistent basis in a meaningful way. And what is meaningful? So the American Heart Association recommends moderate exercise, 150 minutes a week. So moderate exercise are things like walks, yoga, recreational swimming. And if you're going to do vigorous exercise, then you can drop that down to about 75 minutes. Those are things like biking up to 10 miles per hour, jogging or running, swimming laps. So it's actually, when you think about it per week, it's not that much. But if you think about it 5 days a week, well, that's 30 minutes a day. And does it matter if you do it all at once, or how do you arrange your busy life to get all of this exercise in? So I think, what I try to tell my patients in the beginning is start slow. If you haven't exercised in 10 years, you shouldn't start by doing 75 minutes of vigorous exercise per week. That could be dangerous. You could hurt yourself.
Right.
But if you can start with a moderate paced walk, maybe 20 minutes every other day, and then ramp it up, that's probably, a better path for you. You probably will find more success in that. You probably will be able to continue that without feeling like it's a burden, right? Because that's why a lot of people stop exercising, because they don't have time. It feels like a burden. They don't enjoy it. And so I usually tell patients, think about what works for your lifestyle and move. We know that patients who are sedentary, who do not move, have worse outcomes when it comes to heart disease. We know that they develop more commonly develop risk factors for heart disease that cause heart attack. And so when I meet patients, that are actively out there exercising, I'm like, good, great, go for it. These are the actual requirements. Make sure you're doing at least this. But more times than not, it's the opposite. It's people haven't really been doing a lot. And I think the pandemic really affected that as well. Gyms were closed. People got out of their traditional exercise classes, whether it was yoga or Pilates or a senior center. And the push to go back, even though things are opening up and maybe you don't need a mask anymore as much as you did in the past, people got out of that pattern. And to get back into the pattern is hard. So although we have guidelines, and it's always nice to rely on our guidelines and know what's good, we also have to be realistic. And I always tell my patients, if you can't do the 150 minutes, that doesn't mean you don't do anything. It's not an all or nothing situation.
That's a great point. Such a great point. All or nothing. It's not one or the other. Let's just get started and do a little of something is better than nothing, right?
Correct. I agree.
That's a great point. So if I were wanting to talk to my doctor about my own heart health, what are some of the things that I would ask the doctor?
Sure. So you want to know what your basic risk factors are, right? So you want to know when you go into the doctor, what's your blood pressure? Okay. And is that normal? Are you near where you should be, or are you just at the edge of having high blood pressure? So knowing your numbers is important when you're talking about heart health. So know your blood pressure and where it lies in the spectrum of normal. Okay. And then same thing's true for your cholesterol. If you're between the ages of 40 and 75, you should have your cholesterol checked. You should have your ASCVD scraped. And what that means is basically it's an atherosclerotic cardiovascular disease risk score. And it takes into account your age, your race, your sex, your blood pressure, your cholesterol levels. And whether you're diabetic, whether you smoke, the list sort of goes on. But it puts together a score for you, which tells you what your risk of having a heart attack in the next 10 years. And this score is very useful for patients because I think for a lot of times it turns on a light inside when they hear their score to say, okay, I'm feeling great, but this score is a little higher than I want it to be. And then they ask, patients ask, well, why is my score high? A lot of times it has to do with age, but other times it's because the blood pressure is not that great or the cholesterol is not that great. And these are the types of things patients need to know about themselves. These are the types of discussions you want to have with your doctor when you're asking questions about your heart health. So what's my blood pressure? What's my cholesterol? Where do I lie on the spectrum of diabetes? And what's my ASCVD score? And then the other thing you want to really talk about is your weight. If you're somebody who struggles with weight, are you, falling into the obesity category? And what are some strategies, that we just talked about that perhaps could help you reduce your weight? A lot of times I see patients who are, grossly overweight and they come in, they say, doc, New Year's resolution is to lose 50 pounds. And I'm like, hey, wait a minute. Why don't you start with 5? Because I've seen you here 4 years in a row and you haven't lost any weight. In fact, you've gained. So let's not set our goals so high that set ourselves up for failure. Like I said earlier, just small, incremental, positive changes can lead you on a path and a pattern that can really make a difference in the long term. And that's what I always try to really encourage my patients to do is make small positive changes. Because when you think you're going to just overhaul, a life pattern that's been going on for 30, 40 years, and it's just all going to go away. Unfortunately, like most things in life, that's just not the case.
No, sadly, we can't just snap our fingers and have it be different. It takes time and effort. It's usually small, gradual changes that add up to big changes, right?
Exactly.
Yeah. Okay, so I wanted to ask if there are any ties between hormones and heart health.
Well, we don't have enough studies to really make a clear delineation. We know that women who enter menopause early have a higher risk of developing heart disease. We also know that stress can lead to a lot of hormonal changes that can increase the risk of heart disease. We know stress is probably one of the biggest risk factors for heart disease because it leads to unhealthy patterns, right? When you're stressed, you don't eat well, you don't sleep well, patients tend to overdrink, smoke, all the things that are correlated to developing heart disease. And we know that stress can increase hormones that do have some interplay with the heart. How significant, we're not exactly sure. And that's where, a lot of the studies where we look at, what the specific risk factors for women are when talking about women's heart disease, they're not, fully studied and they're not actually fully completed yet. But I think that there's a lot of research and interest in this area, and hopefully with time we'll get more information. Most of the cardiology studies we have, dealing with heart disease were done, years and years ago. And most of them focused on white male. And so there is, some level of uncertainty when it comes to women and patients of different races and ethnicities as to, what the true risk factors are and if they vary significantly from what we traditionally consider risk factors for heart disease for men.
Yeah, no, that is an excellent point that you've just brought up is the differences between women and men or different races and how our heart health could be different and that the factors could be, causing a completely different result than what was studied, 30, 40 years ago.
I think, there are studies, quite a bit of literature out there when it comes to different races and ethnicities. We know that in particular, African-American patients are at higher risk of developing heart disease. We know that South Asians have a predilection to coronary heart disease too, that's being studied. And has been well studied, actually. I think, this idea of specifically, are there risk factors for women? I think it's been an ongoing study that people have looked at for many years. I just don't think that there's been any clear data to say that there's any one specific risk factor in particular that influences women in heart disease more than any other. I mean, I'm sure there's ongoing research, and hopefully at some point we will be able to tease out the data to be a little bit more specific into subgroups. But at this point, I think the main risk factors that we talked about, high blood pressure, diabetes, high cholesterol, being overweight, those are things that apply, unfortunately, sort of globally.
Right. Kind of across the board.
Exactly.
Those factors are going to affect everybody regardless. Would you say there are things that are specific to women, though, that make them susceptible to heart disease, elevated risks for heart attack?
I think, a couple things stand out to me. So I mentioned to you already that we know that the interplay of, early menopause and the decline in estrogen certainly causes an increased risk of developing premature heart disease. It's considered a risk enhancing factor when you're talking to patients about developing heart disease. I think we know that women in general tend to carry more stress, and the hormonal influences of that are an interesting play to see, how that impacts heart disease for women. But I think one of the biggest things that, as a woman cardiologist, that I try to focus in on my patients is that many women can present atypically. So when we think about who presents with a heart attack, with sort of the stereotypical crushing chest pain in the ER, women don't always present like that. And so you sort of have to have your antenna up when you're talking to women about heart disease, because they can present with symptoms that don't really necessarily turn the light on up there. It can be like, well, oh, this is nothing. And then patients have even described situations where they had multiple visits for concerning symptoms that were sort of overlooked because somebody might think, oh, you're too young, or you're a woman, you're not going to have heart disease. So I think that, when as a woman myself and as a cardiologist, one thing that I've seen sort of evolve, and I think it's getting better, is sort of this idea that we're all equal. And just like men, women are at risk for heart disease. In fact, the highest risk of death for women in the United States, even above any cancer. We know that the same risk factors that affect men can affect women. There's probably other risk factors too. And although women sometimes tend to develop it later in age, it doesn't mean that we haven't seen even women in their 40s, 30s developing heart attacks. And it has a lot to do with what I mentioned at the start of the program, is that we know that lifestyle patterns are starting in adolescence. This idea that there's going to be all this stuff around us, fast food, alcohol, vaping, that people are starting earlier and earlier on, that's not going to have some impact on the incidence of heart disease. And when it starts, is very naive. So we are seeing these disease processes start early, including heart attacks. And we're seeing it in women who are younger. And we're seeing it in women who are presenting atypically, not with the crushing chest pain. So I think when I think of women in heart disease, I don't necessarily try to separate them from men, but I try to look more and see what makes their situation more unique and more challenging. And what are things we can do as physicians to make sure that they're treated equally, that they're not overlooked, that their heart disease is taken as seriously and treated as aggressively from the onset of symptoms and onset of diagnosis, so that they can have the survival and the good outcomes that they deserve.
Absolutely. And, you brought up something that is right on. I have a girlfriend who is, in her early 50s, exercises, is very fit, and was complaining of, not chest pains per se, but difficulty breathing. And during COVID, it was immediately written off as, oh, you got COVID and you just didn't know you had it. And now you have breathing problems. She kind of had to push and push to really get this taken seriously. They finally did the testing that was required to check for blockages, and she was blocked. She had to have stents put in. It's just like, this is kind of scary that you're physically fit. You don't look like the type of person that would have any kind of heart disease, and yet you did. And it was almost completely dismissed.
Unfortunately, yeah. I mean, Desiree, this is a story that we don't hear infrequently, unfortunately. And, I think as more women enter into the field, as more people, get familiar with, this type of presentation of younger, otherwise healthy, quote unquote, healthy women, presenting with heart attacks and heart disease, will be in a better situation, in terms of diagnosis and treating patients, because it's hard, when patients get turned away, day, sometimes they're reluctant to come back. And we certainly don't want to miss these diagnoses, in patients.
No, absolutely not. And so during the pandemic, while we were, in lockdown, we're slowly coming out of it. Did you really see a lot of difficulty in what you do in being, in the medical field, being there, trying to get information out, treating patients? I mean, what kind of experience was that for you?
So the pandemic was really something that I don't think anyone could predict. And especially as a physician, it was just full of challenges that I didn't think I would really, ever see in my lifetime. Some of it I couldn't even have imagined. As a cardiologist, we were certainly part of the front line. COVID does impact the heart. It can cause, heart attacks. Anytime the body's under stress, it relies on the heart to sort of keep it going. And if the stress becomes overwhelming, the heart is going to get affected. We know that patients who had existing heart disease had, a lot of issues if they got COVID with either having another heart attack or exacerbations of congestive heart failure. We also know that COVID can cause myocarditis, so an inflammation type of congestive heart failure that the infection could cause. And we saw, patients suffering from that.
So let's just change gears a little bit, I think, and talk about what you would say are the most important things that people should remember when thinking about heart health.
I think, the most important thing is having a healthy lifestyle. Okay. And I know that can mean a lot of different things for patients, but it's an overall global thing, right? It's not something you do today and then you forget about tomorrow. It's not that you eat whatever you want and then go run a marathon. It's everything in conjunction, right? That you do over a long period of time to see success in decreasing your risk factors for developing heart disease. So I think the number one thing I tell my patients is live healthy. And that has so many components to it. Diet, as we talked about, exercise, like we talked about, sleep. I recommend my patients get at least 7 to 9 hours of sleep per night, reducing stress, not smoking, limiting alcohol. I remind my patients 1 to 2 drinks, at most a few times a week. There's not really strict guidelines on alcohol. There was a time where people felt like maybe drinking actually helped the heart. I don't recommend my patients start drinking by any means, but if they do enjoy alcohol, I do remind them to limit it and certainly avoid binge drinking. That's something that's sort of been commercialized in our society as something that's okay. I think we do know that there are detrimental effects to heart disease when it comes to binge drinking, especially its impact on diabetes and high blood pressure, and also can really elevate triglycerides, which are a component of the cholesterol. And I also think that things that, are coming out more and more that are not showing like clear data, but that I think have some social role, things like meditation that give people a lot of peace of mind. Those types of things can help you achieve your diet, exercise, lifestyle goals and be healthy. But again, like I said, I always tell my patients, do it in increments, find a partner if you can, someone to do it with, whether that's a spouse, a sister, a friend, a neighbor, because I think when you do it alone, sometimes it can be taxing. But when you have a partner in taking on some of these, really lifelong challenges to improve your health, it's good to have someone to do it with. That's what I would say, is that focus on a healthy lifestyle in increments with all these components in mind.
Oh, fantastic. That's great, great advice. And reiterating those factors to keep your heart healthy are excellent. You brought up the point of sleep. And I think that's something that, we hear a lot about is we're not getting enough sleep and that affects our heart health. And can you talk a little bit more about that?
Sure. So we know that during the sleep process, there's a lot of healing that goes on in your body. It increases immunity when you get a good night's sleep. We know that it helps with cognitive function. It reduces stress and depression. All of these things impact heart health when you think about it, right? Because if you're not sleeping well, then how are you going to focus on the exercise? Didn't get a good night's sleep. Your tendency is not going to be to eat healthful, maybe the next day. I think that some of these other processes like immunity and depression also play a long standing role in developing heart disease, because you have to be able to take care of yourself to do these things. And so I always tell my patients, if you're not sleeping well, figure out why. People will come and say, I don't sleep well. I never have slept well, doc. Well, I said, well, figure out why, because these things are important. You can do everything right, but if your body's not rested, you're going to be susceptible to a lot of things that you wouldn't be if you were getting restful sleep.
100%. Excellent point. point. So to wrap it up, let's talk about things that you're reading or podcasts that you're listening to, maybe books that you can recommend that the listeners take a look at for their own heart health, or things that might be just interesting topics to learn about. What would you like to share with us?
Sure. So probably if you're thinking about going into a more plant-based or pro-vegetarian diet, and I like to call it pro-vegetarian because I think that, you don't have to completely eliminate everything you like to eat healthful. You can, have the occasional, red meat or poultry if that's what you like. But pro-vegetarian means you purposefully focus on a lot of fresh vegetables, healthy proteins that are plant-based into your diet. I think that these types of diet patients, I feel, including myself, have found a lot of success in because they're really based in moderation. And so one of the books that I like that talks about that a lot is Forks Over Knives, and I recommend that to a lot of my patients. There's a lot of cookbooks out there. I read a lot of them. I look at a lot of the nutrition in these recipes. And what I tell patients to do a lot of times is find what kind of food they like and look for a vegetarian recipe book or a plant-based recipe book that incorporates their cuisine of choice. And a lot of times that works because you're looking for ideas that culturally and socially fit for you and your family. And a lot of times it's challenging because if you're not just cooking for yourself, but you're also cooking for kids, you got to be pretty creative. The podcast that I like right now is The Doctor's Kitchen. There's a lot of interesting guests that the host brings on, but my favorite part of that podcast is when they sort of talk about what's in the presenter's fridge. That's probably the most interesting thing, I think, when they look in the fridge and sort of go over, what people are really doing, because we all have a lot of advice. What's real is real, right? In terms of a book I'm reading now, I just started a book called Self-Compassion. Like I said earlier, I think it's important as a physician or anybody that is working in a field where they have influence over other people, that they actually remember to also take care of themselves and be forgiving, because it is challenging when you take on other people's problems, other people's stressors. Sometimes you can feel a little lost. And so I really recommend, I just started this book, but it's off to a good start. And I would really recommend a book for self-help and, really raising self-esteem, especially if you're suffering after the pandemic from work stress, home life stress, just to get back on track, because I think we all could use a little self-compassion.
Oh, those are great recommendations. I love Forks Over Knives. It is actually what influenced my husband and I to choose a plant-based diet. And our daughters, followed along with us on that journey. To this day, we still eat more of a pescatarian, which is that kind of Mediterranean diet where we're eating some fish, a lot of vegetables, whole foods, that kind of thing. But Forks Over Knives, that was it. We read that, we saw the documentary with all the information about it, and got the cookbook and all of that. And that has been 10 plus years now. And I highly, highly recommend it if anybody is interested in learning a little bit more. That's well-rounded information and documentary about plant-based diets. I love the idea of looking or hearing about what's in the refrigerator of the person who's going to be preparing the food. I love that. So I'm going to look at that, try to find that myself. The name of the podcast is again?
The Doctor's Kitchen.
Okay, fantastic. So I'll include that.
Usually they have, some type of physician or researcher, scientist, presenting on some particular medical diagnosis. And then a lot of times at the end, he has a lot of recipes on his website. And then they oftentimes will go and ask, what's in your fridge and what did you cook and what did you eat last night? And I find that part, in conjunction with the educational aspect of it, to sort of be entertaining. And I think in a podcast, that's usually what you need, some education and some entertainment. So it's a good mix.
Absolutely. Thank you so much for coming on to my podcast, The Pockets of Knowledge. I appreciate you. I'm so honored that you took the time to come and share your knowledge with us. Thank you so much.
Thank you, Desiree. Thank you so much for having me on. I hope that this was useful to all of your listeners.
Oh, for sure. Again, thank you, Dr. Patel, for coming. I appreciate it. And we'll talk soon. Thank you.